Hello and welcome, dear viewers. Today's topic is not just important, it's potentially life-saving. We're talking about tuberculosis, also known as TB, a disease that has silently affected millions of lives around the world. You might think you or your loved ones are safe, but TB can hide silently in the body for years and strike when you least expect it. In this video, we'll cover everything you need to know. How TB spreads, what the symptoms are, who is at risk, how it's diagnosed, and most importantly, how it can be prevented and treated. So stay with us till the end because this information could protect not only your health, but also the health of those you love. Knowledge is protection, and your health starts with awareness. Let's dive in. Tuberculosis TB, a comprehensive medical overview. Definition: tuberculosis terabite is a chronic infectious disease caused by the Mycobacterium tuberculosis complex. It primarily affects the lungs, pulmonary TB, but can also involve other organs such as the brain, kidneys, bones, lymph nodes, and skin. Extrapulmonary TB. The causative organism is a slow-growing, acid-fast bacillus with a unique lipid-rich cell wall that contributes to its pathogenicity and resistance. Epidemiology. According to the World Health Organization (WHO), 10 million new TB cases are reported annually. 1.3 million people die of TB each year. TB is more prevalent in developing countries, particularly in sub-Saharan Africa, South Asia, and Central Asia. Multi-drug-resistant TB (MDR-TB) and extensively drug-resistant TB (XDR-TB) pose major global health threats. Microbiology. Mycobacterium tuberculosis is a non-motile, non-spore-forming aerobic rod. It has a high mycolic acid content in its cell wall, making it acid-fast Ziehl-Neelsen stain positive. The bacterium divides slowly, once every 18 to 24 hours, prefers oxygen-rich environments, hence its predilection for lung apocies. Pathogenesis. 1. Inhaled bacilli reach the alveoli. 2. They are phagocytosed by alveolar macrophages, but survive and multiply inside due to inhibition of phagosome-lysosome fusion. 3. Infected macrophages spread the bacilli through the lymphatic system and bloodstream. 4. Host immune response forms granulomas containing epithelioid cells, Langerhans giant cells, and central caseous necrosis. 5. The infection may be cleared, become latent asymptomatic but positive on tests, reactivate later, especially in immunocompromised individuals. Immune response. TB primarily elicits a cell-mediated immune response. CD for T cells release interferon gamma IF and gamma, which activates macrophages to kill intracellular mycobacteria. Immunocompromised patients, for example, HIV positive, have a higher risk of reactivation and dissemination. Classification. 1. Primary TB initial infection, often asymptomatic or mild, common in children. 2. Latent TB infection LTBI, infected but asymptomatic and non-contagious. 3. Secondary reactivation TB, reactivation of latent TB, often in adults. 4. Extrapulmonary TB affects organs other than the lungs, for example, meninges, spine, kidneys. 5. Miliary TB, disseminated TB, with multiple tiny lesions, millet seed-like in multiple organs. Diagnostic criteria. Clinical symptoms: chronic cough, hemoptysis, weight loss, night sweats. Positive microbiological tests: sputum AFB microscopy, culture on Wensty-Nenzen medium. GenExpert MTB RIF test detects MTB DNA and rifampicin resistance. Chest X-ray findings: cavitation, infiltrates, nodules. Tuberculin skin test TST or Mantoux test. Interferon gamma release assays IgRAs like quantiferin TB Gold. Biopsy and histopathology case-eating granulomas. Tuberculosis TB transmission and high-risk groups. 1. How TB is transmitted: modes of transmission. Tuberculosis is primarily spread through the airborne route, When a person with active pulmonary TB coughs, sneezes, speaks loudly, or laughs, they release tiny droplets, aerosols into the air containing Mycobacterium tuberculosis. These particles can remain suspended in the air for hours, especially in poorly ventilated areas, be inhaled by others, allowing the bacteria to reach the lungs and potentially cause infection. Important notes: TB is not spread through shaking hands, sharing food or drinks, kissing, or touching surfaces. Prolonged exposure in closed, crowded spaces like homes, prisons, shelters increases the risk significantly. 2. Who is at risk? High-risk groups. Certain individuals and populations are more vulnerable to TB infection or progression from latent TB to active disease. 1. People with weakened immune systems. HIV-positive individuals. TB is the leading killer of people with HIV. Diabetics, cancer patients, people on immunosuppressive therapy, for example, chemotherapy, corticosteroids, TNF inhibitors, organ transplant recipients. 2. Infants and the elderly, young children, underdeveloped immune systems, older adults, a natural decline in immunity with age. 3. People living in poor conditions, prison inmates, homeless individuals, refugees and migrants, factory and mining workers living in crowded dormitories. 4. Healthcare workers, doctors, nurses, lab technicians, and others who care for TB patients are at increased occupational risk, especially without proper personal protective equipment (PPE). 5. People with high-risk lifestyles, smokers, reduced lung capacity and defense, alcoholics and drug users, often with poor nutrition and hygiene, malnourished individuals, weakened immunity. Tuberculosis TB key symptoms and diagnostic methods. 1. Key symptoms of tuberculosis. The clinical presentation of TB can vary depending on the type. Pulmonary versus extrapulmonary, the patient's immune status, and the stage of the disease. However, the most common symptoms include pulmonary TB, lung TB, persistent cough lasting more than 2 to 3 weeks, coughing up sputum, sometimes with blood hemoptysis, chest pain, especially while breathing or coughing, shortness of breath, general systemic symptoms, unexplained weight loss, loss of appetite, fever, often low-grade and in the evenings, night sweats, profuse sweating while sleeping, fatigue, and weakness. These symptoms may be mild at first and worsen over time, especially if left untreated. Extrapulmonary TB symptoms. When TB spreads outside the lungs, symptoms depend on the affected organ. TB meningitis, headache, vomiting, confusion, neck stiffness. Spinal TB, Pott's disease, back pain, stiffness, deformity. Lymph node TB, painless swelling of neck nodes. Renal TB, blood in urine, flank pain. Abdominal TB, pain, swelling, digestive issues. 2. How TB is diagnosed. Diagnostic methods. Diagnosing TB involves a combination of clinical evaluation, laboratory testing, radiological imaging, and immunologic screening. 1. Sputum microscopy (FB stain) detects acid-fast bacilli (FB) in sputum samples, done using Zeil-Nielsen staining, quick and inexpensive, but may miss low bacterial loads. 2. GenExpert MTB RIF test PCR-based, detects TB DNA and rifampicin resistance. Rapid and accurate results within 2 hours. Recommended by WHO for initial diagnosis in high-risk patients. 3. Culture on Weinstein-Jensen medium, gold standard for TB confirmation. Takes 4 to 8 weeks for growth. Allows drug susceptibility testing (DST). 4. Tuberculin skin test (TST) MANTA test. Intradermal injection of purified protein derivative (PPD). Checked after 48 to 72 hours. A raised, red swelling greater than 10 millimeters is considered positive. Cannot differentiate between latent and active TB. 5. Interferon gamma release assays (IGREs). Includes quantiferin TB gold and T-spot TB. Measures immune response to TB antigens in blood. Preferred in BCG-vaccinated individuals. Useful for detecting latent TB infection. 6. Chest X-ray CXR. Helps visualize cavities, infiltrates, nodules, and fibrosis in the lungs. Not definitive on its own, but supports diagnosis. 7. Biopsy and histopathology for extrapulmonary TB. Shows case-seeding granulomas. Often used in lymph node TB, bone TB, or abdominal TB. Key points for differential diagnosis. Lung cancer. Fungal infections, for example, histoplasmosis, sarcoidosis, pneumonia, bronchiectasis. Laboratory tests. Test purpose. AFB smear and culture confirm active infection. GenExpert MTB or IF detect TB and drug resistance. IGRE or TST screen for latent TB. Chest X-ray, CT scan visualize lung involvement. ESR, CRP inflammatory markers non-specific. Tuberculosis treatment, a complete medical overview. 1. General principles of TB treatment. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. It must be treated with specific anti-tuberculosis medications over an extended period. Treatment should be strictly followed without interruption, or else the bacteria may develop resistance. 2. Two main phases of treatment. Intensive phase, first 2 months. This phase targets actively multiplying bacteria. The 4 first-line drugs used are HRZ, H-isoniazid, R. rifampicin, RMP, Z. pyrazinamide PZA, E. ethambutol M. Continuation phase next for months. This phase clears any remaining dormant bacteria and prevents relapse. Only 2 drugs are continued. Isoniazid, rifampicin. Total treatment duration, 6 months for drug-susceptible TB. 3. Drug-resistant TB, MDR-TB, and XDR-TB. If the bacteria are resistant to first-line drugs, second-line medications are required. Linezolid, bedaquiline, delamanid, levofloxacin or moxifloxacin, clofazimine, cycloserine. Duration, 9 to 20 months, depending on resistance and patient response. 4. Treatment supervision, DOTS strategy. DOTS equals directly observed treatment, short course. Under DOTS, a healthcare provider observes the patient taking each dose to ensure compliance. This approach increases cure rates, reduces treatment failure and resistance, encourages community-level disease control. 5. Monitoring the treatment response. Sputum smear tests AFB are repeated after 2 months and at the end. Chest X-rays help assess lung improvement. Weight gain, fever resolution, and cough improvement are monitored. Adherence to the treatment regimen is reviewed regularly. 6. Common side effects of TB drugs. Medication common side effects. Rifampicin liver toxicity, red-colored urine. Isoniazid hepatitis, peripheral neuropathy. Pyrazinamide joint pain, liver issues. Ethambutol vision changes, optic neuritis. If any side effects occur, the patient must inform their doctor immediately. 7. Where is treatment done? Hospitalization is necessary for severe cases. Drug-resistant TB or patients with complications. Outpatient care home-based is suitable for most standard TB. Cases under medical supervision. 8. Preventing relapse and protecting the community. Complete treatment is crucial to avoid relapse or resistance. Contacts of TB patients must be screened. People with latent TB may receive preventive therapy isoniazid for 6 months. Good hygiene, nutrition, and regular follow-ups are part of successful TB control. Conclusion: tuberculosis is curable, but only with full commitment to treatment and professional supervision. Early diagnosis and proper medication save lives and protect communities. Prevention of tuberculosis terabyte. Tuberculosis TB is a contagious disease caused by Mycobacterium tuberculosis, primarily affecting the lungs. Prevention is key to reducing its spread, especially in high-risk communities. 1. Early detection and treatment. Prompt diagnosis and treatment of active TB cases is the most effective way to prevent transmission. Screen close contacts, especially family members of TB patients, regularly to detect and manage latent or active infections early. 2. BCG vaccination. The BCG Bacillus calmette-guerin vaccine is the only available vaccine for TB. It is typically administered to newborns in countries with high TB prevalence. It protects primarily against severe forms of TB in children, such as TB meningitis. 3. Proper ventilation and airflow. TB spreads through airborne droplets. Therefore, keep indoor spaces well ventilated. Allow sunlight in, as UV rays can kill TB bacteria. Avoid crowded, enclosed environments for long periods. 4. Use of personal protective equipment (PPE). Healthcare workers and caregivers of TB patients should wear N95 respirators or medical masks. Practice strict hand hygiene. Follow infection control protocols. 5. Preventive therapy for latent TB infection (LTBI). Individuals with latent TB infected but not sick can benefit from preventive treatment, especially if they are at high risk of progressing to active TB. Common regimens include isoniazid, rifampicin, or a combination for 3 to 6 months, especially recommended for HIV-positive individuals, young children, people with weakened immune systems. 6. Lifestyle modifications to reduce the risk of TB. Avoid smoking as it damages lung defenses. Limit alcohol consumption. Maintain proper nutrition to support a strong immune system. Address chronic conditions like diabetes or anemia. 7. Extra care for high-risk groups. Special attention should be given to people living with TB patients, children and the elderly, pregnant women, individuals with compromised immunity, prison inmates, refugees, and people in overcrowded housing. Post-tuberculosis complications and mental health. Even after successful treatment, tuberculosis TB can leave behind a range of physical and psychological after effects that impact a person's long-term health and quality of life. 1. Physical complications. A. Pulmonary fibrosis, scarring of lung tissue. TB can cause permanent damage to lung tissues, resulting in fibrosis or scarring. Symptoms include shortness of breath, chronic cough, fatigue. These symptoms can resemble chronic obstructive pulmonary disease (COPD). B. Pleural thickening and residual effusion. TB affecting the pleural lining of the lungs can cause fluid buildup and pleural thickening. This restricts lung expansion and reduces breathing capacity. C. Musculoskeletal complications. TB of the spine or bones may lead to chronic pain, joint stiffness, mobility limitations. In severe cases, even permanent disability. D. Extrapulmonary organ damage. If TB spreads to kidneys, liver, brain, or eyes, it can cause irreversible functional impairment in those organs. 2. Mental and emotional health. The psychological impact of TB is often under-recognized, but can be just as debilitating as the physical symptoms. A. Depression and anxiety. Long treatment durations, social isolation, and uncertainty about recovery can trigger clinical depression, chronic anxiety, fear of reinfection or relapse. B. Social stigma. TB still carries a negative societal stigma, especially in some communities. Patients often experience shame, embarrassment, social withdrawal, job or relationship difficulties. C. Low self-esteem. Side effects like weight loss, fatigue, and physical changes can impact a person's confidence and self-image. Medical advice and support. Recovery is not just physical, it's emotional too. Patients need holistic care that includes regular medical follow-ups every 3 to 6 months, pulmonary rehabilitation and breathing exercises, mental health counseling, encouragement of a healthy lifestyle, support from family and community. Conclusion: healing from TB is more than killing the bacteria. It means rebuilding strength, restoring mental well-being, and reintegrating into life with confidence and dignity. In today's video, we explored the serious but preventable disease tuberculosis, from how it spreads to the signs, diagnosis, treatment, and even life after recovery. We've covered everything. You need to stay informed and protected. Remember, early detection and proper treatment not only save lives, they stop the spread and protect entire communities. Your health is your responsibility, and awareness is your greatest tool. If you found this video helpful, please don't forget to leave a like, share your thoughts or questions in the comments below, and subscribe to our channel for more valuable health insights. Stay safe, take care of your body and mind, and as always, thank you for watching. See you in the next video. Goodbye.